and welcome to today's episode of Let's Talk About Health. I am your host, Madeline Mant, and today I am absolutely thrilled to introduce our guest, Alex Young, who is here today to talk all about his career as a medical illustrator and science communicator. So welcome to the show, Alex.
Thank you very much, Maddie.
So what is a medical illustrator and science communicator? This is a double-barreled title, and I can't wait to hear all about it.
Honestly, it's a very good question because like the easy answer is like right there in the title. But then beyond that, it gets like a little bit fun to try and explain what it is that we actually do. At its simplest level, you can think of a medical illustrator as exactly that, someone who is going to visualize scientific concepts or medical concepts and use those to communicate and teach people. Now, that's where it sort of like branches out into a myriad of different things and can mean a lot of different things. The easiest examples to think about are surgical illustrations or potentially anatomical or scientific depictions in your textbooks, anthropology, biology, like you name it. That's going to be done by typically a medical or a biological illustrator. But beyond that, our sort of career and field has branched out quite a bit. Now, medical illustrators can also work in 3D, not just in 2D. So it could be creating animations that depict cancer pathways or how particular drugs work. It could also be working in interactive spaces, which is actually what I do. So I work for a company called OSO-VR. And they produced surgical educational modules in virtual reality to train physicians on how to do particular procedures. So I'm working in VR most of the time, working in 3D, and the game development engine that we use called Unity, trying to make some of that happen. So like my job actually somewhere exists between like game developer and like medical content expert. I'm called a medical illustrator. I do very little illustration day to day outside of what I do for fun. So it's a pretty wide-ranging field. You'll also hear it called some different things. Some people might choose, science visualizer, science communicator, scientific illustrator. At U of T, they often call it biomedical communications or BMC. And it's actually one of the master's programs available at U of T and UTM. It's available at the Health Sciences Complex. If folks do want to go and check them out, they're on the third floor. You can like walk through the hall, creep into the computer lab, check out all of the artwork that we're working on. But yeah, a bit of a long and winding answer, but like that is a gist of the different things that we can do.
That is so wide and varied, because I was thinking I've seen the term medical illustrator pop up. Let's say I'm reading, a long form article and I'm scrolling through and illustrations might come up and actually have a slight animation in them. So I was thinking of that as well as what you're talking about with an actual virtual module. So it sounds like there's actually a lot of kind of gamification involved too.
Yes. And I think that's sort of the part that I think does denote the additional like training that you can go into for this. I think that there are folks who do, medical illustration and graphic design related to science that might not necessarily have like the full background and training that I have. And that's completely fine. I think in general, though, the idea is that you are working to try and communicate accurately whatever scientific concepts exist in like that piece that you're working on. So it could be for journal articles, like you said, it could be for patient education materials. I've had some experience doing that in the past. And it can also be for physician or other healthcare provider education, or also for students. But I think, yeah, the main thrust is that you are working to visually communicate those concepts. And then the big thing is accuracy and making sure that it is true to the science or the medicine itself, to the best of your abilities, and working with scientists, researchers, healthcare providers to make sure it's like on the nose in terms of how accurate it is and making sure that you're presenting it appropriately.
Yes, we would certainly hope so. But I like what I'm hearing you say. There are things like medical content expert, and I'm hearing a lot of different stakeholders in there. And so within anthropology, we talk a lot about terms like health and disease and illness and wellness and sickness. And these terms can be complicated and kind of loaded. So I want to know, how do you engage with or think about those types of words in your work?
Yeah, that's a really good question. It's a fun one too, because I think it does change almost based on who I'm working with or the project that I'm doing. And it's not necessarily that the way that I think about them changes, but like where they are in the forefront of how I'm thinking about maybe communicating a particular piece. So I guess we could like think of like my current day job first, and then we can move into some other examples. But like what I'm currently working on is creating these surgical modules that physicians and folks who work in the OR, the operating room, can go through so that they learn the sort of procedure itself, not necessarily working on like their fine motor skills on like how to do a suture or how to, make an incision. They do those things, but the more important part is learning the procedural aspect of it so that they actually sort of reduce the cognitive load of understanding those steps when they're in the OR. So in that case, our focus really is on providing an engaging and informative educational experience to increase the comfort of the healthcare providers in that setting, and by doing that, make it better for patients as well. So if you're going to see increased patient outcomes because the surgeries themselves are going to happen more quickly, physicians are going to be more comfortable with them. And we're seeing like better success rates as a result. So when I think about, sickness, wellness in that respect, it's about increasing like the wellness for healthcare providers and patients, making sure that folks are comfortable in what they're doing, because the way that they typically learn it is like not necessarily the best. Like it's printing out PDFs of like what that surgery actually is, reading it, because they're doing so many different surgeries before they actually get into the OR. So if we can reduce that, make it better, and then by doing that, make it better for patients as well, like that's really exciting for me. But that's that one example, right? And if we sort of flip to some of the other examples I talked about, patient education materials, maybe explaining how a cancer drug works, because that's another job I've had in the past as well. That one is sort of encapsulates all of those things as well, because you want to make sure that you are accurately describing what sickness is, in this case, cancer, but you also want to do it in an empathetic way that is respectful of the patient's experience and takes into account their lived experiences, what they're going through in that moment, what their caregivers and family might be going through in that moment, but still providing them the information that they need in terms of what's happening in their body, what options they have available for them in terms of treatment. And in the cases where I was working on a very particular treatment, what is that treatment doing in your body? And then what are the sort of outcomes, both positive and negative, because it's going to treat it, but there's also always going to be side effects. So thinking about how you can describe sickness and wellness in an empathetic way while still being accurate, like we said, because that is fundamentally like one of the most important things that we have to do.
It's so interesting to hear how patient-centered that this work can be. That, it might be you working maybe alone, maybe isolated and within one program on something, but that you see that there are these patient outcomes in terms of, both mental and physical health, it sounds like.
Yeah. That is another great segue. My past job before this one was actually working for a healthcare consulting group in Toronto called Bridgeable. They focus particularly on human-centered design. So making sure that you are bringing the people, the users, in our case, it was often patients and healthcare providers, into the settings that you're working with. And I think that's informed a lot of what I've done. But I do think it also informs broadly what medical illustrators do. I like to think so anyway. I'm a little bit biased, but I think it needs to be patient-centric or user-centric, because if you are, and like this really broadly applies to like design in general, but if you are making things without the people who are using it in mind, it's not going to be particularly effective. And I think that honestly applies to like medicine in general as well. If you're not doing things with people in mind, the folks who are going to use it, it's not going to be super effective or successful. And so we can be as accurate in our depictions as possible and make beautiful illustrations, which I've seen done. But if they're not taking into account the people who are using them and the audience, it's not going to be great. And I think you see that in a lot of medical illustration as well, because yes, there will be examples, like I mentioned, textbook illustrations, but medical illustration can also be graphic novels talking about palliative care, talking about depression and anxiety. Medical illustration can be those, virtual experiences that I talked about. There's one that was started by a medical illustrator in Chicago who does VR experiences for people with different disabilities. So in particularly, they did one with macular degeneration. And so they'll get caregivers, PSWs, healthcare providers to put on a VR headset and go through like what it's like to be at a restaurant, what it's like to be at a birthday party, this
Right.
sort of like cinematic experience. But you have macular degeneration shown in your field of vision because of VR. And that's all about like putting them in the, the shoes of someone who actually experiences that, and then what it's like to give. So there's so much that you can do within it. But again, I think it all does really come back to that user or patient-centric viewpoint so that you're doing it well.
I'm hearing so much about empathy in there too. That's really, really interesting because we talk so much in anthropology class about how anthropology is everywhere and it's everything. But I'm like, is medical illustration everywhere and everything? It kind of seems like it might be, but it's so broad, and it sounds like you don't have to just enjoy drawing to get into this. That makes sense. Like it sounds like there's so many different pathways. So how would a student who maybe is listening to this conversation and is finding themselves in this conversation, how would somebody who might be interested in following in your footsteps pursue a career like this?
There's so many different ways. I will say the very specific pathway that I took, and then I'll broadly talk about some other things because I don't think it's the only one. But biased. I like to be MC. I had a good time there. It's at UTM. So there are 5 accredited schools, I believe, in North America that can sort of give you the master's in medical illustration. They call it slightly different things, but that is essentially what you're doing. 4 of them are in the States, so always an option. But the one in Canada is, like I mentioned, at U of T. In that case, you do need to have an artistic portfolio. They're not necessarily looking for you to be the best artist. There are folks who are going to be in the program who are phenomenal at drawing. I was in a class with many of them. I don't think of myself as like a particularly incredible illustrator. I've definitely learned and gotten to a place where I'm comfortable with it, but there were folks in my class who are way better. But you need to be able to show that you understand at least like the fundamentals of art in that, but also the fundamentals of design, because I think even though it is wide ranging, understanding design and how to design something is sort of like the basis of what we do, and that can be applied to all of these different things. Apart from the portfolio itself, they are looking for a background in science to a degree. It doesn't mean that you have to have a complete, scientific major in your undergrad. There are some prerequisite courses that they're typically looking for, like cell biology, a little bit of physiology thrown in there. But they're just the courses rather than a specific degree requirement. And yeah, then you go through an application process. They look through the portfolio. You do an interview if you go through. The class sizes are relatively small. It's about 18 students a year. So it is somewhat competitive. But once you go through, you get sort of access to all of these incredible things, and you do start getting to dabble in all of these different things as well. I do think the program was super useful for me in terms of exposure to these things and the folks who I can also learn from, but you don't need to do the program to do those things, right? I think that there are ways to learn about design, to learn about, human-centered design, like we already talked about, but also the fundamentals of art and design theory without going through the program itself. And so if you already have an interest in that, you can pursue that independently. You can pursue that through, there are also courses at UTM where you can sort of get a little bit of exposure to this as well. So that's always an option. And then thinking about like how it can be applied as well. So that first job that I talked about at Bridgeable, technically I worked as like a business consultant, and they specifically looked for folks that had this BMC background, but that's not the only background that they hire from. They have folks who came in with like as high as their, why am I forgetting the name of folks who do business masters, but that's a thing. Yeah, there we go. So there are folks who did have their MBA. But that was like almost like upper echelon sort of deal. There were people who had like just gone through either design school or anthropology, or had gone through a scientific background, because it was about doing some of that research, because that implied a lot of what we did and informed a lot of what we did, but then also translating that research, which they honestly teach you more of on the job. And yeah, in terms of what I'm doing now as well, right? Like there's a whole field of other folks who work with us. Like it's not just medical illustrators making these VR modules happen. There's developers and engineers. There's people who help us actually like explain things to the clients that we're working with. And those backgrounds sort of are myriad as well. So there's a lot of different ways that you can get adjacent to the field and also in the field yourself by practicing some of these things. So the master's is one way. It is not the only way. And there's also access to professional organizations within our field that are independent of the schooling that you've done as well. So there's technically the Association of Medical Illustrators that sort of represents and helps guide folks within North America primarily, but also globally. And yeah, we have a ton of folks within that organization who come from the master's programs, but also who have worked outside of it and are just as successful, and I think just as passionate about doing what we do as well.
Well, you have given us so much to chew on and so much to think about here. It's such an exciting career, and it sounds like there's so many different ways in which it can be used. And it's so inspiring to hear that backgrounds in things like anthropology and biology and various types of science can lead somebody to a career like this. So I want to thank you so much for your time today and for sharing all your expertise with us.
I'm very happy to chat about it. Yeah, and if anyone has any other questions, they can reach out, but also BMC's at UTM, so you can go ask them.
It's on the same floor as my office. So if anybody comes office hours, you're welcome to check them out afterwards. But thank you to Alex again. Thank you also to our entire audience for joining us. And we will see you next time on Let's Talk About Health.